Swayam Prabha. Digital India. Educated India.
Dear students, hope you all are doing well. Welcome back to another exciting session of soft tissue characterization and applications. So far we had been studying about different sorts of tissues like the skin, muscles and the brain, and we started in 6 different organs, and basically we are going to continue into understanding the different soft tissues which are existing from the head to toe. So let's get started again. So the next soft tissue we are going to talk about is the esophagus. Esophagus kind of extends from the mouth to the stomach. It's a tissue which is highly nonlinear and is typically a muscle channel. Has a length of approximately 25 to 30 centimeters and is 2 to 3 centimeters thick, right? This has a primary function of transporting the food and water bolus via the neck area, which is known as the pharynx, to the stomach, right? So this is a fairly extended system from here to here, right? So typically a muscular ring at the esophagus inferior end, known as the cardiac sphincter, closes the esophagus end and captures food into the stomach. So there is a sphincter, or a sphincter is typically what allows you to voluntarily swallow or voluntarily allow a certain passage to open up, right? So that's the sphincter it is being talked about. So this is known as a cardiac sphincter, which closes the esophagus end and captures this food in the stomach. So this is on the other end. The biomechanical properties of the esophagus wall consists of both active muscle contractions and passive elastic and viscoelastic characteristics properties, right? So you need active contractions majorly on the top side to make sure that the food is going down, and it is going as we speak, and the passive contractions are needed to make sure there is proper churning of the food, to make sure it is not a lot of food which is accumulated in a certain region. Then you will have an urge to kind of drink water or something which can lubricate and send our food down, right? From a anatomy standpoint, you are looking at the level of upper central incisors, which are the teeth on the right figure, and you're looking at the upper esophageal sphincter. So this sphincter allows the food to be swallowed from your mouth, right? Then you're looking at the different stages in terms of going from the top to the bottom of our body. You're looking at the thoracic inlet, where there is the sternal notch. This is specifically the area of cervical esophagus, and then followed by the upper thoracic esophagus, middle thoracic esophagus, and finally going all the way to the lower thoracic esophagus, or the esophagogastric junction, or the EGJ. This is how this is termed, right? And then there is a diaphragm, which diaphragm typically separates two different organ systems, which allows the separation. And then you have the abdominal esophagus, where finally the food is going to your digestive system, right? So this is as far as the esophagus structure and the different soft tissues involved are concerned. Let's go further. The next soft tissue is a very important soft tissue. Again, it's the human lungs, and we have realized the importance of lungs even more during the pandemic, right? Like where we are seeing that breathing can become a difficulty due to several infections and soft tissue changes, right? So the lung tissue is a highly elastic pair of large spongy organs located in the thoracic region, lateral to the heart and superior to the diaphragm. Diaphragm is what separates the thoracic region from the digestive system, right? The left lung, due to pointing of the heart, is slightly smaller than the right lung and consisting of 2 lobes, while 3 lobes are in the right lung, right? So in terms of lobes, or the categorization of the different segments of the lungs, you can see on the right figure there is a superior lobe followed by the middle and the inferior lobe, This is for the left lung. So this is for the right lung when you look at from the screen. And from the left lung standpoint, you are looking at two different lobes because of the placement of the heart. And in both the lung segments, you have the connections with the trachea, which is the air passageway into the lungs, followed by the superior lobe, then the main bronchus, which is the just very close, not connection with the lobes. Then you have the lobar segmental cardiac notch, followed by the inferior lobe, and then the final concluding part of the lungs end where the air goes up till is known as bronchioles, followed by the alveoli. Alveoli are the tiny sacs at the very end, up where the air kind of gives out the oxygen and basically takes up the oxygenated blood and takes the uh, gives out the deoxygenated blood. So that's the exchange of cleaning of the air, like, which happens. So the primary function of the lung is to provide oxygen into the blood and clean the blood from carbon dioxide. In return, very tiny air sacs through the alveoli, right? From an anatomical standpoint, you're looking at intercostal muscles at the very top, like, which are forming part of your ribs. Then there is a chest wall. These are the different soft tissues which are present. Chest wall is having different segments such as the rib cage, sternum, thoracic vertebrae, connective tissue, and intercostal muscles. These are all part of the chest wall. And then you have the diaphragm, which separates the lungs, where the lungs are, and from the digestive system. Then the lungs also have a set of cross sections such as the pleural sac. Then you have the intercostal muscle, pleural cavity, and final the visceral pleura. These are the different. So if you were to cut the lung or poke the lung from outside, these are the different muscles or the different regions of the cross section which you are going to encounter. So fairly complex tissue, but overall, does the property of the lungs depend on all these different demarcations of the soft tissues? That is to be found out through understanding of the mechanical properties. So we are going to study that at length, what the mechanical properties are. So all the different kinds of soft tissues or the soft tissues cross sections which are there as a part of the lung or any soft tissue organ doesn't necessarily mean that they contribute in a completely different property. It could be that lung has a very unique property going from one location to another. It has a very similar mechanical property. So the mechanical property may or may not get influenced by the different anatomical segmentations. So this is something to be looked at length when we talk about the mechanical properties, right? Okay, the next one is the most classic and the most commonly studied soft tissue, which is the human heart. So it's a muscular pumping organ situated in the thoracic region, and this is all the thoracic region. It is medial to the lungs and near to the body's midline of almost, and it's about 2/3 on the left side of the body and remaining 1/3 on the right. So it's a little bit more towards the left. So typically, if you're trying to hear your heartbeat or feel your heartbeat, you would put your palm a little bit towards your left rather than in the middle or to the right, right? If one assumes an average rate of contraction of 75 contractions per minute, that's a normal contraction, a human heart would contract approximately 108,000 times in one day. That's a huge number, right? 108,000 times. So this is almost like we're looking at a 108,000. More than 39 million times in a year and nearly 3 billion times during a 75 years lifespan. So we can well imagine how beating of the proper beating of the human heart is important for our well-being and normal functioning, right? So heart we had seen a little bit differently in our initial lectures, where we wanted to look at the heart fibers and the heart matrix and whatnot, how we look at a soft tissue. But just looking at the heart as a whole in relaxed version, it's a different soft tissue configuration versus in the contracted version, because the fibers have pulled out or they have contracted. They're having different interplays, which is causing the entire structure to look very different, and the mechanical properties of the tissue to also change. while it functions. So heart may have a different mechanical property of the soft tissues at a certain time frame versus a little bit of different property at a different time frame, right? Whether that is significantly different or not, those are things to consider, right? So from an anatomy of the heart standpoint, we have already studied this in a biology class, so I'm not going to repeat through all these aspects, but just going to quickly cover some of these pointers. So you have the superior vena cava, you have the aorta, you have pulmonary vein again, you have the right left atriums, which are the two uh, top left and right segments of the heart, and you have the inferior vena cava and the right and the left ventricles, which are forming the bottom part of the heart, right? And then you have a set of valves which makes sure that the heart, the blood in the heart goes from one segment to another in a much more streamlined manner, right? Like it's not going randomly from one to another, like from left to right or something like that. It has a clear order which is well defined in the area of biology, right? So we're going to skip that. We're going to focus just on understanding what heart is, and that's what we did. And we are going to talk about the mechanical properties as we go along, right? Let's go further. The next soft tissue is the breasts. So breasts consists of fat fibrous tissue and functional glandular tissue such as mammary glands and milk ducts. This is an extremely highly studied soft tissue because of several reasons, because of incidences of breast cancers, and as well as like implants. So there are so many cosmetic implants which are fairly popular in this region, right? The breast comprises of 15 to 25 lobes consisting of branching ducts leading to the terminal duct lobular units from the collecting ducts, right? So from a soft tissue standpoint, it is distributed like this on the right figure. We are looking at the ribs, and followed by the ribs you have a series of muscles, and between that, between the ribs and the muscles, you're looking at the chest wall, right? And then the breast tissue basically begins, and within that you have a fatty tissue with lobules, lobe ducts, and finally terminating at the nipple, right? So this tissue is extremely complex in its structure, very soft, and this is often studied for different impact scenarios and different clothing scenarios, surgical scenarios, and so forth, right? Next soft tissue is the human liver. So liver may seem like a pretty big organ from the figure on the right. It's not that big. It's a little scaled up version, but it's still one of the largest organs on the human body, right? Liver is located on the right side of the stomach and is the second largest organ after the skin. So skin, if you consider it as an organ, then it's the second largest organ, right? So it's quite big. Weighing about 3 pounds, the liver is one of the human visceral organs, right? Performing several complex and critical functions such as the metabolism of proteins, carbohydrates, fats, and the storage of minerals, vitamins, right? One of its primary function is bile production, and its absorption into the small intestine is for the food digestion, right? So liver's one of the primary function is to digest food. The liver consists of numerous vasculature vessels, right, like in terms of blood vessels and all sorts of vessels, endothelial and parenchymal cells like hepatocytes, stellate cells, fibroblasts, and epithelial cells. These are different biological terms out there, right? But from a structural standpoint, you're looking at the liver to have a right lobe and a left lobe. You have a falciform ligament which separates the lobes, and there is a gallbladder located at the bottom side, and then you have the inferior vena cava and the aorta which are passing through. This is if you're looking at the liver from this side, right? If you're looking at the liver from the back side, so anterior view, anterior is always the front, so I am facing the front if you're looking at the liver from my side. Then That's the figure on the left, and if you're looking from inside or my back, then that's the posterior view. So from a posterior view standpoint, you're again looking at the aorta and the like this inferior vena cava. You're looking at a left triangular ligament, which is one of the key ligaments which attaches the liver or fixes it in the right location. Then you have quite a few elements here, such as the coronary ligament. You have the porta hepatis, claudat lobes, claudat process, right triangular ligament, fissure for teres ligament. Then you have teres ligament is also something important which fixes the liver. Then you have portal vein, common bile duct, quadrate lobe, gallbladder. Gallbladder is a small segment which is just at the bottom of the liver, right? So liver as a soft tissue, it's not extremely complex, but this can get very complex under disease conditions like fatty liver or liver cirrhosis, where there is the stiffening in the property as well as some changes in the structure. So that's why studying the liver is also very important for understanding the soft tissue as a general, right? So another comment on the liver: this is a very widely researched soft tissue, because of one of the reasons that majority of the impact injuries or ballistic injuries usually affects or punctures the liver. If you have like a vehicular accident, that also punctures the liver. So that's why liver is a very highly studied organ in terms of mechanical properties, right? And it is commonly used for many finite element or computational models. Let's go further. The next tissue is a gallbladder tissue, which we just noticed at the bottom of the liver. This has a function of its own. So this is a thin, soft, pear-shaped functional organ attached just behind the right liver lobe, right? The gallbladder's primary function is to contain and discharge bile into the duodenum, so that lipids from the food can be reused for digestion. So gallbladder again is responsible for the digestion, right? It is divided into three regions, namely the fundus, neck, and hepatic duct, right? Fundus is usually the top kind of whatever is, like you can have fundus of a stomach, you can have fundus of the uterus, like all the different organs have fundus. This is a common terminology, right? We are going to look into the structure in a moment. The fundus is the widest portion and tapers medially, right, which in turn narrows to become the neck. So the fundus, then it kind of tapers and then finally forms a neck, right? The neck angles slightly superiorly as it approaches the hepatic duct. The cystic duct is about 1 to 2 centimeters long and turns inferiorly as it bridges the neck and the hepatic duct, right? So from a structural standpoint, um, uh, by the way, the gallbladder does not look green the way it is shown here. It is a piece of soft tissue or an organ, so which has very similar color to any other muscles or other soft tissues, right? So from a structured standpoint, you're looking at just like any vegetable, like you're looking at the gallbladder fundus, like which is at the very bottom, then the body followed by the neck, then you have a cystic duct. They have certain meanings while why they are being named that way, because they are releasing certain like juices or biles, bile here specifically like for the digestion and other things, right? Then you have the right hepatic duct, left hepatic duct, and a common hepatic duct, and finally the common bile duct. This is the final exit of the bile, how the bile is sent out to the stomach, right? So this is how the gallbladder looks like. This also has a high tendency of getting punctured during a trauma. However, the gallbladder is not a very widely studied organ, and it's still open for research in terms of mechanical properties. And I'm going to talk about several of these organs, how they have been studied over years, in terms of which organs have been studied more, which have been studied less. These kind of things I'm going to discuss in the upcoming lectures, and that's going to form the foundation of understanding all the different soft tissues, what's out there and what's not out there. Next is stomach. So we are slowly going down as we move towards the bottom of our body. This is almost the middle. We are still in the middle segment. So the stomach is a muscular sac situated between the esophagus. So esophagus kind of concludes into the stomach, and the duodenum in the upper portion of the abdomen, right? So duodenum is the bottom part of the stomach, and then you have the top part, which is esophagus. So this is two connections, right? And it's in between. It is the primary organ of the gastrointestinal tract, right? And serves as a nutrient reservoir, ensuring the proper time for the absorption of big meals, right? Whenever you're taking big meals, it has to have proper absorption of the food to make sure like all the essential nutrients and everything can be taken out and provided to the body to function rightly. The stomach contains gastric enzymes and fluids which converts the partially digested food into a semi fluid mass, right? And this is carried forward through certain stages of operations for nutrient absorptions through the intestines, which are we're going to discuss in a moment, right? So from a tissue standpoint, as I've just mentioned, the stomach is kind of lying in between the esophagus and the duodenum. We are looking at certain segments here. We are looking at, followed by the esophagus, we are looking at the lower esophageal sphincter. Again, we are talking about a sphincter which allows the food to enter from the esophagus into the stomach, right? This is followed by cardia, which is one of the key soft tissue out there, and there is a fundus of the stomach, like I had mentioned. Then you have the body of the stomach, and then you have muscularis externa. These are some of the key muscles which are responsible for different functions. They have several different layers, such as mentioned here in the figure: longitudinal layer, the circular layer, and the oblique layer. Every layer, or the way the fibers are oriented, defines a certain function of the stomach or the organ in consideration, right? Next, the food kind of moves down, and you have the rugae of the stomach, followed by then there is a greater curvature. Why the certain curvature is there for the stomach, that also has a scientific meaning and reason, right? So one of the key things as we study about this different organs and soft tissues, I would like to highlight, this is something which really fascinates me, how every organ is so beautifully created in terms of all the different soft tissues which are nicely blended in different layers, specifically built for certain functioning, right? So everything has a certain reason or a function. Nothing is out there for vain or just cover up, right? There are few cover up tissues like which are just the covering layers or giving a right cushion for certain soft tissues or organs, but most of them have certain functions which are beautifully defined by the nature, and how they are all organized together, right? So this is something we would all like to appreciate while we discuss or go through the different stages of this soft tissue characterization and applications, right? So coming back to the stomach, we are looking at pylorus, where then followed by the lesser curvature, pyloric sphincter, and then finally the duodenum. If we are looking at any of the cross sections on the side, zoomed in, we are looking at several different layers as follows. You have serosa, which is one of the inner layers, then followed by the um, uh, muscularis externa, submucosa, and the mucosa, right? So the mucosa is typically what is in touch with the food. So that's what you're seeing. So you're looking at a reverse picture here, right? So you're looking from outside to inside. Mucosa is the one inside, right? So very complex organ with a lot of different forms of soft tissue. But the question here is, do we need to study all these different soft tissues, or we can study a few and consider the others to be very similar? These are some of the questions we would like to answer as we go through this course, right? So let's get to the next soft tissue. The next one is a very unknown kind of organ, like not very widely studied, which is known as the spleen. The spleen is a flattened, oval shaped soft tissue situated on the upper left of the abdomen, lateral to the stomach, right? This measures about 10 centimeters in length, yeah, 10 centimeters, and weighing 150 grams. So not a huge organ, but 10 centimeters is still quite a bit, right? Like it's not very small. Spleen is a rich reservoir of blood which functionalizes to filter high blood volumes. So one of the key functions of the spleen is to filter blood, right? Like to filter blood out of all the toxins and whatnot, right? So those things are in question. It consists of a thick fibrous connective tissue capsule filled with red and white pulp and is the least stiff organ in the human abdomen. So in the human abdominal region, which is the bottom region, it is the least stiff organ, means the softest organ out there. So think about an impact or a blunt trauma or a ballistic trauma. What do you think is going to get impacted or affected the maximum? Which organ, right? This is going to be the spleen because it's the softest organ, easy for damage. And then probably rest of the organs around it are going to get damaged. From a soft tissue standpoint, it has an outer capsule, right, which has a trabecular structure. Trabecular is very common word for any like inner structure inside the capsule. And then you have vascular sinusoid, white pulp, red pulp. These are some of the components, but does it affect the soft tissue? We'll have to see based on as we go through the different lectures and understand what are the mechanical properties and how the spleen is characterized. And then you have the artery and the veins, right? So you have quite a few components in a single organ, but it could be that the mechanical properties of this organ as a whole is very similar, right? Like if you take a piece of specimen from here versus there, right? So even though it has a lot of components, one of the rule of thumb is it doesn't necessarily mean that the mechanical property is highly anisotropic. It could be fairly isotropic. So these are the things we would like to explore as we go along. But this is an organ we should know, which is a unique composition of the soft tissues, right? Let's go further. The next organ here is the pancreas. So the pancreas is a large organ situated just inferior and posterior to the stomach in the abdominal cavity, right? With its head linked to the duodenum and its tail pointing to the left wall of the abdominal cavity. It is about 6 inches long and shaped like a small lumpy snake. That is how the description of the pancreas is given typically in the modern literature or the modern anatomy, right? So for, for the chemical breakdown of carbohydrates, the pancreas secretes digestive enzymes into the small intestine, right? And then finally it causes the breakdown of the carbohydrates, the carbs, right? Pancreas comprises both endocrine and exocrine glandular tissues and is known as a heterocrine gland. Many of these terms are widely known in biology lessons, so I'm going to skip that. We're going to focus on the soft tissue aspect, right? So looking at the structure of the pancreas, here we are seeing quite a few different components, and I think you can see some internal components here as well. So we are basically looking at the common bile duct, we are looking at the pancreas in between, and you are looking at the spleen on the side, right? So the pancreas has the acinar cells which secretes the digestive enzymes. You have the pancreatic ducts, you have the duodenum of the small intestine where it kind of ends, and then you have the pancreatic alt, right? You have the alpha cells, beta cells, and exocrine acinas. These are different components if you are looking at a microstructural level, right? But this is how the structure looks like, and sometimes the structure becomes really important along with the soft tissue mechanical properties, because this affects how this is going to get impacted or punctured or diseased. So a lot of these things depend a lot on the structure, right? So that is why understanding the structure as well as the properties of the system, how they are connected with the different organs in the vicinity, is very, very important. So this is how the pancreas is. Let's go further. The next tissue, which is also a very important component of the digestive system, is known as the colon, or sometimes we call it as colon, right? So colon, commonly known as the large intestine, is a dense tube about 2.5 inches in diameter and has an average length of 1.5 meters, 1.5 meter. So think about height of a person. Many standard adult would have like a 1.6, 1.7, 1.8 meters. So this itself, this colon, which is the large intestine, is 1.5 meters, right? Very interesting. So this is all nicely coiled around in the stomach region or the abdominal region, so that it could fit or adjust within this length, and it is kind of coiling around, right? The primary function of this organ is to finish the absorption of the nutrients and water. So the absorption of the nutrients and water starts well within the stomach, but kind of as the food goes through different levels of churning down from the stomach to the colon, then you're basically looking at further absorption of the nutrients and water. It also synthesizes certain vitamins, forms feces. Feces is the final stool which we excrete, right? And eliminates feces from the body, right? It is just inferior to the stomach and coils along the small intestine's upper and lateral border, right? So let's revisit this large intestine from a picture or a structure standpoint on the right side. Here we have already taken this lessons in class of biology. I'm sure many of us have already looked at this, but this is just a refresher into what the structure looks like, right? So you are looking at the column, this colon, where cecum is the basically the starting point of the colon, and then you have ileocacal valve, followed by the ascending colon, which is ascending means like, or ascending, whichever way you want to call, which is going up, right? Then you have the right colic flexure, followed by the transverse colon, which is known as a segment of Hastron, right? Then you have the left colic flexure, finally followed by the descending colon. And this kind of transitions itself into the sigmoid colon. These are the different components of the colon, and finally goes to the rectum. Rectum is where our bowels or the stool is stored, and finally can be excreted out of the anus, right? So this is the configuration of the colon, but it's not hanging in the air. It's coiled in a very nice way and held at different fixture points to make sure it's just not hanging out or recoiling itself or doing some other activities, right? It should be uh, fairly there where it needs to be, right? So this is as far as the structure of the large intestine is concerned. Extremely complex mechanical properties of the soft tissues, which has coiled structures, longitudinal structures, circular structures, to make sure the proper churning of the food can be conducted in order to also absorb all the essential nutrients before the food completely gets exhausted and it is going to get excreted, right? So these are the different steps in which the colon functions. The next soft tissue in line is a very important soft tissue again, which is known as the small intestine. The small intestine is a long thin tube about 1 inch in diameter, 20 to 25 feet long, right? So 20 to 25 feet, quite a bit, right? Normal human size, human height, 5 feet to 6 feet, maybe 6.5 feet, right? You're looking at almost 4 or 5 times of the 25 feet long. So extremely nicely coiled, even nicer than the large intestine, right? So part of the lower gastrointestinal tract, this small intestine is, and this is distinguished as duodenum, jejunum, and ileum. These are the 3 different segments of the small intestine, right? It is located just below the stomach and takes up most of the space in the abdominal cavity. Quite intuitive, like, because it's quite a good bit of length, right? You're talking about 25 feet. that has to be coiled very properly and nicely to be placed or packed within the stomach, right? So this takes up the maximum space. The entire small intestine is coiled like a hose, and the inside surface is full of many ridges and folds. This makes sure the proper churning of the food can happen, right? These folds maximize food digestion and nutrient absorption, right? So you're looking at the duodenum, jejunum, ileum, finally followed by the large intestine, and then you are looking at the rectum. So these transitions through the small and the large intestine are very, very important for the right absorption of food, right? Food nutrients. But the thing to watch out is these specifically the small intestine has a very soft kind of wall which can get very easily punctured during any trauma. So the mechanical properties of this particular small intestine has not been studied a lot. So this is something which I'm going to describe in the upcoming lectures, that who all in literature have done some research in the small intestine, what needs to be done more, right? Let's go further. The next soft tissue is the kidney. So the kidney or the kidneys are a pair of organs in the form of a bean located along the abdominal cavity's posterior wall, right? So these are all part of the abdominal region, and kidneys, as we know as a whole, are very important components of our body. Since the right side of the liver is much greater than the left side, the left kidney is positioned slightly higher than the right side kidney, right? So there is a little bit of differentiation in the position. The kidneys are situated posterior to the peritoneum and are in contact with the back muscles, so the back side of our body, right? A thin layer of adipose protects the kidney. Adipose tissue is a very common tissue which forms the lining of several important organs in the human body, right? So this also does the same job for the kidneys, keeping them in place and preventing physical injury. Injuries to the kidney is a very vital issue, right? If the kidneys get injured, the blood and everything is not filtered, and there is a huge issue with the toxin development in the body, right? So that's why making sure that the kidneys are protected is very, very important. The kidneys play a crucial function in the body by filtering metabolic wastes, excess ions, and chemicals from the blood, maintaining the water balance of salts, water, and minerals. So you can well imagine how important this kidneys are, right? And are nearly twice stiff as the liver, extremely stiff and strong organs, right? So the mechanical properties of the kidney have almost the property as strong or as stiff as the liver, right? So typically when the kidneys fail, you have to go through a dialysis or that kind of a situation, right? So the and it is sometimes possible to work with one kidney, but of course there are depleted functions or things do not work exactly how they should be in the body, but you can still function or live a comfortable life with a single kidney, right? So let's look at the structure of the kidney. It's like a bean shaped organ. You are looking at several different components. You're looking at, first of all, let's go from the outside to the inside. You're looking at cortical blood vessels. Cortex is usually the top part of the covering. You're looking at cortical blood vessels. Then you're looking at arcuate blood vessels, which are kind of the inside part of that. Then you have interlobar blood vessels. This is the same set of blood vessels which are branching out, but they have been given different names based on where they lie across the cross section. So cross section is if I poke the kidney through a needle, then these are the different levels of the cross section I'm going to experience or hit, right? So that's how the different components of the blood vessels or how they're flowing through the different parts of the kidney or along the cross section has been demarcated with different nomenclature. Through the interlobal blood vessels are there, and then you have the minor calyx, which is the inside part of the kidney. Then you have the major calyx, and you have quite a bit of veins and nerves like the renal vein, right? You have the renal nerve, renal arteries, which are all getting their junctions kind of plugged in into the kidney here, right? Then you have the medulla, ureter, and the capsule, right? Of course, the cortex was already explained. So renal column is already there, and papilla and the pyramid and the renal pelvis. So these are some of the components of the kidney. But to all having all these components affect the overall mechanical properties, that's not the true part, right? The kidney has a much more isotropic property from what we have seen in the mechanical properties, which I'm going to explain in the upcoming classes. But it has a lot of components, but not necessarily a lot of different properties as we go from the top of the kidney to the bottom or side to side, right? But it does have a lot of components. So this is about the kidney. Let's look at one or two more organs which are of importance. The next one is the urinary bladder. We all know urinary bladder kind of stores our urine, and it's a very important organ of a human body. It's a hollow organ for collecting and excreting urine, and positioned at the lower end of the pelvis and in the body's midline. So it's along the midline of the body and along the pelvis, right? The urine enters via the ureters into the urinary bladder, slowly filling the bladder space and stretching the elastic walls. So the bladder has elastic walls which are slowly stretched out, right? It's not like bladder is a strong kind of hard organ where you just fill in liquid. It is a stretchable organ, so it stretches up. These walls allow it to be extended and contain around 600 to 800 milliliters of urine, right? So that's the overall amount of urine which can be collected in one go. After that, you have an urge of urination, right? So from a soft tissue or structural standpoint, you're looking at the figure in the middle, and so on the right we have two components. Let's look at the figure on the left. So you have the two ureters feeding in the urine, and the urinary bladder collecting the urine. Then you have the detrusor muscles, which are basically elastic muscles which will expand to collect that urine. Then you have trigone region. Then you have the bladder neck, internal urethral sphincter. Sphincter I was again talking about here. The sphincter is totally voluntary. Like we have the sphincter, like farnial sphincter we have like for swallowing food. We have a sphincter right next to the bladder, which helps us take the decision whether we want to urinate or not, right? It's not like our bladder fills out and we start to urinate. Never happens like that. So this sphincter we can regulate through our sense, and we can have certain signaling to the brain and tell it that please open that sphincter and now I want to urinate, right? So these are very very complex soft tissues, how they're nicely coiled, and like they can be stimulated or non-stimulated. So these soft tissues are really worth a mention. If you're looking at a infant or a very elderly person, their sphincter functioning is kind of depleted, right? Like their functioning is not very proper. They're not able to control it very nicely. So that's why you would have an infant who is not able to control their urination. They are just urinating when their bladder is full. Same with a very elderly person. They do not have that much strength in their sphincter. Then you have the bladder neck, followed by the urethra, and finally the external urethral orifice, right, through which the urination happens, right? From a overall standpoint, you are looking at the kidneys. Within the kidneys, you are having some influence of the aorta and the inferior vena cava, and the kidneys are connected through the ureters to the urinary bladder. This is good to know how the different connections of the organs are there. And finally, the bladder concludes at the urethra, urethra. Yeah, so that's where you basically the urination component is. But what is worth mentioning is the structure of the urinary bladder, how elastic it is, and what kind of muscle and other soft tissue properties it has. This is something we are going to discuss as a part of this course, right? Let's get to the next one. The next one is a very important organ, the uterus. This is specific to the females. The uterus is an organ which basically houses the fetus or the baby, right? Through the cervix, it is connected to the vagina and the fallopian tubes. This tissue is usually pear shaped and is about 7.6 centimeters long, 4.5 centimeters wide, and 3 centimeters thick, right? It undergoes great deformation during gestational growth and showing significant changes in mechanical properties to house the fetus. So, this is very interesting to note that the uterus goes through an extensive amount of mechanical properties change, how fibers develop over time as the fetus is housed through the different months, going from the month 1 to ninth month, right? So the uterus kind of prepares itself for strengthening the baby and making sure it is ready to deliver. So the mechanical properties, if you pick a piece of sample of the like of the tissue from the uterus on the month 1 versus month 3 versus month 9, it may be heaven and earth difference. So this is a very interesting area in which lot of research is being conducted to understand the mechanical properties of the uterus. What is the right mechanical properties? Sometimes if it is not right, then the fetus may be in some difficult condition, or there could be a troublesome delivery. So there are a lot of implications of studying this, right? So at the early level of labor, the uterine muscle appears to be isotropic. This is another very important thing to note. However, it exhibits anisotropic behavior as the labor progresses. So the uterus muscle is extremely isotropic or similar if you pick a sample from any direction, but it becomes extremely fibrous and anisotropic henceforth as it progresses through different stages of the labor, right? The uterus is surrounded by ligaments such as endopelvic fascia, such as the cardinal, pubocervical, round and uterosacral ligaments. So these are different ligaments which holds the uterus or fixes it at different points with the different other tissues and the bones, right? The uterus primarily consists of soft muscle tissue, collagen, elastin fibers, and is also sometimes known as the womb, right? From a structural standpoint, you are looking at the uterus, which is connected with the fallopian tube, and then you have the ovaries, right, which is the eggs, and then it kind of moves towards the endometrium, followed by the myometrium, to the cervix and to the vaginal opening, right? So this is the female pelvic system where uterus is an extremely important area to study, and a lot of researchers are working into understanding the mechanical properties not only of the uterus but as the pelvic system as a whole, which we are going to look at next. So this is the last soft tissue organ system which we are going to talk about. It's not a single organ, but it's a organ system. So this is known as the female pelvic system, extremely complex. I have personally worked in this area in terms of computational research, trying to study very complex interaction between different organs and how they can get damaged when there is a disease condition versus different stages of the labor. And the computational modeling in itself includes a lot of different geometries and contact conditions, right? So very interesting area to study. So a smooth, elastic, and muscular canal that acts as an entryway to the female reproductive organs is the vaginal tissue, right? This tissue serves as the delivery channel for the childbirth. The vaginal tissue is about 7.5 centimeters along the anterior wall and 9 centimeters along the posterior wall, right? So this is the entryway. Other pelvic organs and the pelvic floor muscles are present in the female pelvic system. Let's take a very quick look into the female pelvic system. So you are looking at a very sandwiched kind of structure of different organs which are placed together. You have the urinary bladder at the very front, right? Like, so if you're looking at me, like if from a female standpoint, you're looking at the urinary bladder at the very front. Then you have the uterus, which is in between, and then finally you have the rectum, right? Rectum. So this is what you're seeing on the figure here on the left, right? Then you have a set of ligaments which are holding this together from different angles and bones and whatnot, like pubis is a particular bone, you have the sacrum as a different ligament, sacral ligament. Then you have a pelvic floor muscle. Pelvic floor muscle in itself is a very complex muscle. It's kind of a V-shaped or a M-shaped muscle which holds all these pelvic organs together in place. So while the child or the fetus grows, this pelvic floor muscle goes through a lot of wear and tear and changes in the properties. So it is not only the property of the uterus, but it changes the properties of the pelvic floor muscle as a whole. The property of the bladder and the rectum doesn't change, but what does happen is as the uterus is growing big and big during the different phases of the labor, the bladder segment, which is there for the urination, as well as the rectal segment, which is for the feces to pass or the stools to pass, they get pressed or stressed. So that's why you sometimes get something which is known as a urinary incontinence. This is one of the disease conditions in which a particular female is not able to urinate in the proper way during the different stages of the labor. So this is a lot of disease and biological implications, how the soft tissue properties and structures change over time, right? From a front view, you can look at several ligaments in which all these organs are specifically looked at. So can you study the female pelvic system as with a single organ, like just the uterus? You can, if you place all the different contact conditions and all the other loads and everything perfectly. Otherwise, you would like all the organs to be placed in terms of the modeling and then have the right contact conditions defined, right loads defined. Otherwise, you are going to run a wrong analysis and you are going to not get the right results, right? So this is a lot of different ligaments and different connections, fixation points, as well as there are places from which load transfers will happen from one organ to another, right? So you're looking at one of the computational models here at the bottom, which kind of has the pelvic bone. You have the femur bone, which is the longest bone in our body, which is part of our legs. Then you have the female pelvic system with the different muscles and the organs in between. All the organs are here, and there are certain loads and fixture points which have to be placed. These have to be very accurate as per the anatomy. If these are not accurate, you will not be able to analyze or find the right mechanical property or the overall response of the system. What are some of the important areas to study the female pelvic system? One is childbirth simulations, problematic childbirth simulations. Then you have there is a disease which is known as a pelvic organ prolapse. This is a homework. Many of you can look it up. You know what it actually does, and this is implication into not only the different organ structures, how they have changed with different stages, like of a female life cycle, as well as how their mechanical properties have changed, right? So those things, and you have other traumas and like other scenarios and disease conditions which are also like cancerous tissues, like cervical cancer. These things can also change the tissue properties. So to conclude here, when you are studying the female pelvic system, it's an organ system rather than a single organ, where every organ has several different tissue layers and components in itself. So you have to understand this from either a holistic standpoint by including all the organs and the structures and the fixtures, or if you're focusing on one organ, you have to just focus on that organ and simulate all the other conditions which could have been there in a real scenario, right? So soft tissues, just to conclude, have differences in the overall response or the properties, not only due to the mechanical properties of the native tissue, but also due to their structure, also due to the other structures they are attached with, right? So these are some of the very interesting phenomena or interesting attributes of the different organs or the soft tissues which we are going to study throughout this course as we go along in the upcoming sessions, right? So stay tuned, And with that, I would like to thank you all. I'll see you again shortly.